education. I pay for, you know, people who refuse to work and use whatever excuse to get SSI. I pay for them.
Yeah.
I need for me, so I can keep on paying into this pool so they can get. I put my money in, they take it all before I get it.
So you're for lower taxes?
I'm for healthcare for me, taking care of the people that put into this country. That's what I'm taking it down. I want Katrina to evacuate. You know what I did when I came here? I got a job.
Right.
That's where that pink bracelet, because I didn't want to be that, because I knew what that was. I need you to go back to Washington to advocate for me. We don't have to overhaul everything. Lower the cost of health care.
Right.
And give it to those that need it.
That is
That's
exactly what
all
I
I need. Please do
mean. We do not need to work on the 45 or 50 million people. We need to look at the people that
don't have it.
have jobs, that need access, that can't get access, and
stop
provide a way.
handing out all this free stuff to folks that refuse to put into the
Boy, do I believe it. Oh, good, thanks.
Kenny, I'd like to ask just one question.
Yeah.
All these bills, NAFTA, this healthcare bill, you know, 2 feet thick, how many weeks to read, but nobody anywhere has been able to tell me, and why can't somebody pass the legislation that will mandate, line by line, word for word, who the author was for each item in these bills, so that you have a paper trail, so you know where you can go look and see who these people are,
Yeah,
and what their backgrounds are, and what their agendas are.
Absolutely. Not one single bill, not one single earmark should be passed that you don't know exactly who put that earmark in the bill. We still don't know who put those 5 airplanes in the bill. And the truth is, the person that put those in the bill did not want you to know who put those in the bill. So we need absolute transparency. Absolutely. Get, we didn't run out there. Yes, ma'am.
I don't need a microphone. Tell me I have the loudest voice in Texas.
I can hear you. Yeah. They can't, but I can.
Yeah, you can. I read that 50 billion or million, I'm sorry, 500 billion or million was going to come out of Medicare to pay for the health care. Who made that decision? Is that just an arbitrary decision, or?
Well, when the president rolled out the health care plan, the first question that came to everybody in America's mind is, okay, fine, how much is this going to cost, and who's going to pay for it? Okay. Many husbands can sympathize with that in the crowd. How much is this going to cost, and who's going to pay for it? Well, that was the first thing that came to people's mind. So it, out of thin air, in my opinion, they snatched a $500 billion figure and said, we're going to save $500 billion from waste, fraud, and abuse from the Medicare system. Well,
why haven't they done it before?
Why haven't they done it before? And we began to say, okay, all of us would be in favor of saving from waste, fraud, and abuse, but we believe that you're going to make those savings, that $500 million savings, by cutting the coverage and by cutting appointments, by cutting what doctors are paid, what hospitals are paid. And we think that finally this is going to come out of the hide and come out of the lives and come out of the health care of those that are on Medicare.
Why do you believe that instead? Why do you believe that instead of actually looking for fraud?
Because we haven't been shown any. That there isn't a list anywhere. But you can't go and spend $1 trillion and then hope that you're going to find $500 billion worth of waste, but it's,
Want to see where they think they're gonna find it.
absolutely. And if it's there, then we'd be willing to spend that kind of money. The other $500 billion is going to come from taxes.
No.
And that's a simple truth of it. And that's where they lost all the Republicans, and they lost really a bunch of the conservative Democrats. And that's why the bill is having such trouble, because of the taxation part of it. And there's no way to pay for this. There was no way to pay for the stimulus bill. There was no way to pay for the TARP bills. There was no way to pay for every single dollar of the $3 trillion that have been spent in this country in the last 12 months. There's no pay for it. They're not cutting one dime in your spending, and they're not paying for it. They're selling bonds that are going to be paid back by your grandkids and their kids with inflated, worthless dollars. So, well, the more he prints, the less valuable. Okay, was that a man or a woman? That was one question back here at the back.
What does the bill state about funding abortions?
Repeat.
The bill coming out of committee, I don't believe is written to allow abortions. But I believe that, and I don't believe the Senate bill has it in there either. But the Senate bill has not come out of committee yet. So I think you have 100 million people watching that very thing. And I haven't been able to find it. If somebody here knows where it is in the bill, I'd like to know, but I don't think it's in it. Yes, ma'am.
I have a question about that particular gentleman's question. I heard that if it's not in the bill, if they say that it is like neutral, that's kind of code for the panel will decide.
I think that's a permissible interpretation.
So if the bill is silent, we need to really be worried about it.
And there were amendments offered in committee that specifically said, under no event will this be.
And they turned it down.
But it was not. Those amendments were not adopted.
Exactly.
So it leads to me to believe that they want at least the interpretation of that to be right.
Exactly. And I brought my USA Today yesterday where Nancy Pelosi and Steny Hoyer called us un-American. I'm a true American patriot. I am an American. She can take out that U and put an A in it. That's all of us. True American patriots.
Thanks for that question.
Exactly.
Yes, sir.
Sometimes they say, I've heard them say there's a bill, I think it's a Perkins bill, that keeps abortions from being funded by the government. Is that right?
Well, there are several amendments that will do that, and there's probably some standalone bills. I don't know if it's Senator Harkin or not. My health care guy is standing right there by you. He might be able to answer it. But there are several standalone bills that preclude the federal government from ever paying for an abortion unless it's endangers the life of the mother. Judge.
My question is, if this bill is passed, will I lose my current insurance and my current doctors?
Yes.
You will not right away. You will not right away.
But in time we will.
Well, I think in time, who do you work for? I mean, is it a private company? Is it
Federal Express,
Federal Express?
and it's Cigna Insurance.
It's my belief that in time, if the bill is enacted the way it is here, that there will be so many disincentives for a company to provide health care to you that they will just wash their hands of it, pay the penalty, and put you into the public plan.